Welcome to Live with the Eczema Doc, brought to you by Clean Body, where we believe that you can heal your skin from within by cleaning your body. I'm Dr. Fong, a naturopathic doctor specializing in eczema, and I'm here to guide you through the journey of understanding the root causes of your eczema so that you can finally achieve the clear, healthy skin you deserve. Each week, we combine research-backed insights, science-based strategies, and my years of clinical experience to uncover what's really triggering your eczema and how you can take control for lasting relief. Let's dive into today's episode and uncover the next step to healing your skin from within. Hello, everybody. Today we are talking about a very important essential vitamin that I really need you to think about as we are getting into the winter season, especially if you have eczema or any other inflammatory autoimmune type conditions. And this vitamin is vitamin D. Vitamin D is so important. And as winter comes along and as we have less and less exposure to the sunlight, this becomes more and more important. Today, we are going to talk about how important this vitamin is. We are going to go into why it's important, how to test these levels, how to make sure that you have optimal vitamin D levels, how to increase it as well. What can you do to increase this vitamin D naturally? And then what can you do for supplementation if needed? And so today, again, we are talking about vitamin D, how vitamin D can actually help soothe your skin if you have eczema, and how it can also boost your immune system during the winter, which is so important. So we're going to go into the studies that tell us, that vitamin D is so important. So why does vitamin D matter for eczema? Well, eczema is often really characterized by an overactive immune response. And what studies are telling us is that vitamin D really helps regulate the immune function and potentially reduces the frequency and severity of eczema flares. So vitamin D can be really important. And a study published in Science Advances found that vitamin D deficiency can trigger immune pathways associated with inflammation and autoimmune disease. And so this can be particularly important for people with eczema, people with other autoimmune diseases as well. Specifically for vitamin D and eczema, we are seeing studies that indicate that low levels of vitamin D are associated with an increased prevalence in eczema and severity. And I'm seeing this in my patients clinically. Often when I am testing my patients, I am seeing very low levels, 19s and 9s for vitamin D. And we're going to talk about what levels we want to see your vitamin D at shortly when we talk about testing. Now, how do we boost vitamin D? Well, the primary source is going to be sunlight, and specifically the UVB rays. Now, this is interesting because for eczema, UVB light therapy is actually one of the treatments that is very widely used for eczema patients. And one of the reasons may actually be that those UVB light treatments are stimulating vitamin D production. So that's one thing to really think about. UVB therapies also decrease inflammation and do some other things. But I do think a part of that UVB therapy being effective is the increase in vitamin D that likely happens when you use that light therapy. Now, we are getting some of this through food, and fatty fish is one of the big places we're going to get the vitamin D. You can also get vitamin D from egg yolks, fortified foods. So we do fortify a lot of our things like breads and milks and things like that. And then mushrooms. Mushrooms actually also make vitamin D when they're exposed to the sun. So we can get that from our mushrooms like shiitake mushroom and maitake mushrooms. Now, if you are going to get sun exposure, there's a couple of key things to think about. You want to aim for about 15 to 30 minutes in general of sunlight. And you do need to be exposing large part of your areas, namely your face, your arms, your legs. So, if we are completely covered up and we're going out in the sun, we're really not getting that exposure that we need. And then you also want to think about your skin color. More fair-skinned individuals might need less sun exposure, and then darker skinned individuals may need more sun exposure, just depending on that protection, that natural protection you have on your skin. And if you are going out in the sun and you're trying to get that vitamin D exposure, you do want to avoid using sunscreen for at least that 15 to 30 minutes so that you are soaking in those UVB rays and creating that vitamin D on your skin. That can be really important. So the natural ways of getting vitamin D are really what we need to focus on. But unfortunately, a lot of us are not getting enough sunlight. A lot of us are not eating these foods. And therefore, a lot of our levels are low. And again, we are seeing this correlation with people with eczema and having these low levels of vitamin D. So we need to do some testing, and vitamin D is often tested on yearly labs. However, your conventional doctor may be looking at these reference ranges a little bit differently than we would on my team. We are naturopathic doctors and nutritionists, and so we are looking at this a little bit differently. I call it a functional medicine approach. It's looking at more optimal levels, especially for someone with eczema. So conventionally, that range is anywhere between 30 and 100. And if you are at the lower end of that range, it may not be sufficient for immune boosting and also for eczema people. So what I would like is anywhere between 45 and 65 usually. And for someone with eczema, I would be happy even going up to about 80. Sometimes do need supplementation for this. Often we're just not getting out there in the sun enough, and we're just not getting enough from our food sources. All right. So if we are going to supplement, there are a couple things that you need to know. If you are going to supplement, I will choose D3 over D2 for better absorption and utilization in the body. And then you also want to make sure that D3 is paired with K2. So D3 can actually pull calcium out of the bones. So we do need to make sure we're pairing it with K2 to put the calcium back into the bones. K2 can help with that process of putting calcium into the bones, and also making sure that that calcium is not going into the soft tissues and causing things like kidney stones, calcium buildup in the arteries and things like that. And we will see that people who are supplementing with vitamin D alone without the K2 may end up having things like kidney stones and, calcium deposits in the arteries and things like that. So that's how you can protect yourself when you're supplementing with vitamin D. All right. I do recommend that you get some testing and you consult with a healthcare provider if you are considering using vitamin D supplementation. And regular doses usually are anywhere from 1,000 to 5,000. But typically, if we are seeing people who really need that bump in vitamin D, I will go up to 7,000, 8,000, sometimes even 10,000 IUs per day. And then, once we get to those levels, then come to a more moderate dosage. So this is something you definitely want to work with a practitioner on so that you are making sure that you are getting the right dosage you need. Vitamin D is a fat-soluble vitamin, so if we take too much vitamin D, those levels can get too high. And then when we have too much of a vitamin, it also isn't going to be good for us as well. So, it's really just kind of that just right in terms of dosing. I have found clinically that people do have problems with vitamin D supplementation, and there are a couple of reasons this could be the case. When people are taking vitamin D and they get symptoms like nausea or stomach discomfort or headaches, this can be common. There are a couple of reasons. Maybe you're taking too high of a dosage. So you want to start really low with maybe like a 400 IU or 800 IU dosage and then slowly increase. If you aren't taking that vitamin D with a fatty meal, since it's a fat-soluble vitamin, you can experience some digestive sensitivity. Again, you want to make sure to pair that D3 with K2, and that really allows for a balanced calcium distribution when you're taking vitamin D3 supplementation. And sometimes people can have a magnesium deficiency, and this can cause an issue with the absorption as well of the vitamin D. So you maybe want want to take a magnesium supplement or eat magnesium-rich foods like leafy greens, nuts, and seeds to make sure that you have enough magnesium. We do deplete in magnesium when we get really stressed, so this can be something that you might want to think about. Now, vitamin D is especially important right now, and this is why I wanted to talk about this right now, because winter is coming. Things are getting colder every day now. The sun is coming down earlier, and so we are definitely getting less sunlight. And of course, we're going to be indoors because it's nice and cold, right? So we're going to be covering up. And so we really are not getting enough of that vitamin D. So oftentimes you want to make sure you're getting enough of that vitamin D during the summer, during the warmer months. You're out there, you're in the sun, you're getting that vitamin D produced in your body. And basically when that UVB touches your skin, your body will create vitamin D, and your liver will actually activate that vitamin D. So we want to store this vitamin D. It's a fat-soluble vitamin. So if you're getting a lot of sun exposure in the summer, you may have a good amount stored up for the winter. That would be the hope. But again, a lot of us even aren't getting that sunlight exposure during the summer months, during the more sunny months. And then that's where we can have some problems here. In a 2017 meta-analysis, people with low vitamin D levels were more likely to experience respiratory infections, and supplementation was associated with a reduced risk of infections, especially when people had a deficiency. So if you want to protect yourself from the upper respiratory infections that really circulate during the winter, having optimal vitamin D levels can be really important. In a 2020 study, vitamin D was shown to help modulate the immune response to COVID-19, reducing the severity of symptoms in some cases, okay? And this is also true of flu as well as other viruses that we are really exposed to during the winter. So not only is vitamin D so important for eczema and making sure that we are really modulating that immune response, it is important for the winter. And, as we all know, often for eczema people, sometimes eczema gets better in the winter, sometimes it gets worse. And some of the vitamin D deficiencies could be a part of this. Okay. If you are having eczema, if you have autoimmune disease, if you have any inflammatory conditions, I do definitely recommend getting testing for vitamin D along with a bunch of other testing. But vitamin D can be one of those tests that, almost always anyone with chronic disease, chronic inflammation, autoimmune disease, eczema will see that those vitamin D levels are low. And remember that conventional reference range, that's, between 30 and 100, and your vitamin D might be around 36. We want to see that vitamin D level a little bit higher. So, around 50 would be great. And for an eczema person, between 50 and 80 is really what we want to see. And then how do you get to those numbers, is important in terms of lifestyle, nutrition, but also supplementation. And then making sure you're working with someone to get the right dosing for that is really important. So at Clean Body, this is something we test at the very beginning. We're testing every single person for vitamin D, and we are starting supplementation typically. And we are giving you lots of lifestyle recommendations for getting out there in the sun, and also nutrition recommendations for eating vitamin D rich foods. Okay. Thank you for joining live with the Eczema Doc. I hope today's episode provided you with valuable insights and tools to support your journey to healing your skin from within. For more information, visit www.cleanbody.health or check the links in the podcast description. You'll find the studies and resources discussed today on my blog. You can also take my free eczema root cause assessment to uncover potential triggers, or download my free eczema relief guide for quick, practical tips to calm flare-ups and help with your sleep. If you found this episode helpful, please remember to like, subscribe, and share the podcast to help others on their healing journey. And if you'd like to stay updated with future episodes, please turn on your notifications so you don't miss a thing. Please remember this podcast is for informational purposes only and does not constitute medical advice. Always consult with your healthcare provider or book a consultation with me before making any changes to your healthcare regimen. Use the code LIVE30 to enjoy 30% off as a thank you for tuning in. When you clean your body, you heal your skin from within. Thank you again for listening, and I'll see you next week.